So the topic for my presentation is the efficacy of fascial-iliac compartment blocks in proximal femoral fractures in the pre-hospital setting, and it's a systematic review and meta-analysis. I do not have any financial and in-kind support disclosures. So today I'm going to be speaking about a systematic review titled The Efficacy of Fascial-iliac Compartment Blocks in Proximal Femoral Fractures in the Pre-Hospital Setting. So what does this study mean for our real-life patients? So proximal femur fractures or hip fractures are one of the most common and painful injuries sustained in patients of all ages. It's generally associated with high risk rates of oligoanalgesia, especially in the pre-hospital setting. Our current treatment options, not just nationally within Canada, but internationally, include parenteral opiates as well as sedative agents. Although regional anesthetic techniques are becoming more common, so study investigates those. We are looking at several different objectives. Our primary objective here is to look at if there's any improvement to pain score pre and post intervention, and as well as between arms, so standard of care versus FICP blocks, as well as any adverse events, overall patient satisfaction, and success rates. 5 studies were included after a very rigorous screening, which started with 422 studies, and all of the studies did demonstrate a low risk of bias. Looking at Figure 2, which demonstrates our change in non-verbal pain score pre and post intervention, we can note that following the fascial-iliac compartment block, there was a statistically significant decrease in pain score. Within our studies included, there was a total of 226 blocks which were conducted, and there's an overall mean improvement of 6 points, which is quite significant, and the effects of dispersion between these studies was high. If we move down to Figure 3, we're looking at our pain control standard of care versus our fascial-iliac compartment block, and if there's any significant differences between these. As you can see, there was some significant difference between the standard of care as well as the fascial-iliac compartment block. The issue with this is that although it does favor the fascial-iliac compartment block, there is a low overall effect and relatively or moderate heterogeneity. Because of these results, we ended up doing a sensitivity analysis of our included studies, and the sensitivity analysis demonstrated that heterogeneity was accounted for by one trial. Removal of this trial by SladeS and al. Did not have any effects on the summary estimate, but heterogeneity was reduced to 69%. In regards to other outcomes in general, fascial-iliac compartment blocks had a lower overall rate of adverse events compared to the standard of care. Patient satisfaction, interestingly, seemed to be about equal between standard of care as well as the trial arm, and the success rate of the blocks was overall quite high, with the study by SladeS and all having a astounding 96% success rate using doing blind fascial-iliac compartment blocks, which is quite interesting. To note, the training for this study was much more rigorous than that of the other studies. So in conclusion, fascial-iliac compartment blocks for proximal femur fractures in the pre-hospital setting does result in a statistically significant decrease in nonverbal pain scores across patients. It also carries an overall low risk of adverse events, as well as high patient satisfaction and a high rate of success. So what does this mean for the future? This study, although it's small and there's not a lot of included studies, tells us that the blocks are very safe, very effective, and could potentially be implemented not only into practices within the emergency departments, but also conducted by our allied healthcare professionals, which could be definitely beneficial to our patients living in rural Northern Ontario. Thank you guys for your time, and have a wonderful day.